OCD, with 1 in every 50 people suffering from obsessive-compulsive disorder, adding up to 1 million in the UK alone. It's time it was looked into properly. For the final time of our 4-part info blast, welcome to the Mental Echo. Obsessive-compulsive disorder is a mental disorder consisting of 3 main steps. 1. Thoughts that cause worry, more commonly known as obsessions. 2. The anxiety caused by these thoughts. And 3. The actions taken to relieve this anxiety, known as compulsions, all of which cause a great disturbance to a person's life, physically and mentally. Obsessions can be simple phrases, images, or ideas that are shocking in nature, such as death or accidents, which can cause someone with OCD to become anxious, guilty, and depressed. It is the reason for them partaking in rituals as a safety barrier against these thoughts. What must be remembered is that these thoughts are repetitive for a lengthened period of time. Compulsions are varied entirely for different forms of OCD, but mainly consist of rituals, contradictory thoughts, avoidance of certain objects, people, etc., hoarding and reassurance from others. With this basic backbone for OCD, let's look at some rumours about it. So many people believe that someone with OCD is a neat freak who only worries about cleanliness, usually being a stressed out adult female. All this is wrong. OCD doesn't mean obsessive cleaning disorder, it's obsessive compulsive, meaning it can be an obsession based on anything. However, it is understandable to believe this due to most OCD sufferers having an issue with cleanliness. Secondly, it isn't just adults that can suffer from OCD. 1 in 200 children and teenagers suffer from OCD, which is the same ratio for those suffering from diabetes in that age range. OCD also isn't caused by stress, it is caused by uncontrollable fears and anxieties. And even though stressful situations can heighten symptoms, it isn't the main cause. It also isn't what is classed as a woman's disease. According to the International OCD Foundation, OCD affects men, women and children of all ethnic, racial and economic backgrounds at the same rate, meaning we all have the same chances. Finally, and possibly the worst, is that people believe that OCD can't be treated. It's true that it cannot be cured, but there are multiple methods available to help control obsessions and limit compulsions so that those with OCD can live much more freely. If you believe you or a loved one are suffering from OCD, you need to look out for the symptoms. Some people naturally have a high level of self and space preservation and will clean of their own free will. So if you or a loved one does any of the following through their own choice, then the likeliness of it being OCD is very low, as the actions taken are usually due to being anxious. Most people with OCD will have a strict hand washing schedule, usually done due to a fear of germs and contamination, with fears such as contamination after washing being signs of OCD. Will be overzealous when cleaning, again due to fear of contamination. However, it is only a sign of OCD if multiple hours a day are taken to clean, and you become anxious and nervous if it is left afterwards. Finally, they'll show checking behaviours. This means that the person returns to an object, person, or something else, and repeats an action or checks a machine repeatedly to confirm everything has been done properly. 1 or 2 times shouldn't be of concern. 3 to 20 times on a regular basis, however, should be when further action is taken. For those diagnosed with OCD, there are 2 main options when looking into treatment. These are cognitive behaviour therapy and/or medication. Due to every case of OCD being different, treatment can consist of purely medicinal aids or purely behavioural therapy, or a mix of both. But most people will start treatment by using medicines to gain control over compulsions and behavioural therapy to maintain this control. The medicines commonly used for OCD treatments are called neurotransmitter serotonin and can significantly reduce the symptoms of OCD. Large studies have shown that 75% of people using this form of medication have had decreased symptoms, and more than half have only encountered compulsions of lower intensity and frequency in comparison to normal. However, this method takes 3 weeks before visible improvements occur, and if medication is stopped entirely, relapse can occur. This is the general reason for patients to have an indefinite reduced dosage of behavioural therapy. The main form of behavioural therapy used currently is known as exposure and response prevention. This is when the person with OCD will deliberately partake in an activity which will cause obsessions to occur. This can be imaginary or in real life. From there, they will be asked to refrain from partaking in any form of ritual for as long as possible, with most therapists asking patients to refrain for several hours. This form of therapy is very emotionally draining and means that the patient needs to be fully motivated and determined to partake in these activities. However, the majority of patients will complete therapy with the same effects achieved from medicinal treatment without medical implications, and relapse is less likely to occur. If any of the topics covered in this episode affect you, or if you want more information on OCD, we'll include a list of websites, books and leaflets you can refer to in the description. And your GP or school nurse can also answer your questions. Feel free to contact us with any queries or requests, which we can address in following episodes at thementalecho@gmail.com. If you are suffering or know someone who is, remember, knowledge is the first step to understanding.